Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Let's review the similarities and differences between placental abruption and placenta previa. These are the two major causes of late pregnancy bleeding. With placental abruption, we have a detachment issue. The placenta is detaching from the uterine wall before the baby's born. Clinical symptoms are going to vary depending on the degree of separation. With a placenta previa, we have an attachment issue because the placenta is attaching to the lower uterine segment. And when this happens, it can partially or completely cover the cervix. So placental abruption is also referred to as Abruptio placentae. Risk factors for placental abruption include hypertension, drug use, typically cocaine or methamphetamines, blunt abdominal trauma, so things like intimate partner violence, car accidents, falls, things like that. Or also cigarette smoking can contribute to this as well. Signs we might see with a placental abruption are going to be dependent on the degree of separation. Typically, placental abruptions are painful, and they can be significantly painful. Dark red vaginal bleeding could be seen if the abruption is along an edge of the placenta. The thing with a placental abruption is it's possible not to see vaginal bleeding if the abruption is hiding behind the placenta and all of the edges are still intact. We see uterine tenderness, rigid board-like abdomen, uterine contractions, and an abnormal fetal heart rate pattern. Because the blood that should be going through the placenta for the baby, not all of it is going now. So we can also see late decelerations. We can also see DIC and shock with these patients. So with this, the placenta is separating while the mother still is pregnant. And so we're seeing bleeding inside the uterus and then potentially coming out through the vagina. This is not something we can typically diagnose definitely with ultrasound because it depends on where the abruption is if we can see it with the ultrasound or not. For a placenta previa, remember this is an attachment problem. So risk factors with a placenta previa include previous uterine scar. So if she's had a C-section before or if she's had other uterine surgeries before, advanced maternal age, multiple pregnancies, or if she's previously had suction curettage, that can cause scar tissue inside the uterus that could contribute to this as well. With placenta previa, the things we might see, the bleeding with this is painless. She's not feeling abdominal pain at all. She just notices blood in her underwear. The bleeding with the placenta previa is typically a bright red bleeding. There's a potential for profuse blood loss with placenta previa. The abdomen will be soft and non-tender. Oftentimes we can see an abnormal presentation with this. So because the placenta here is attached in the lower uterine segment and covering either partially or completely the cervical os, the baby may be transverse or oblique. We can also see an elevated fundal height because the baby is above the placenta. With this, we'll normally see a normal fetal heart pattern unless there is significant blood loss happening. And with this, coagulopathies are rare. With this, we can see the placenta is attached on the lower uterine segment covering the cervix, and we can diagnose this with an ultrasound. This is how we can really confirm it. If a patient has a placenta previa, we should not be doing vaginal exams because doing a vaginal exam can poke the placenta and cause it to bleed. So the other thing with a placenta previa is that it can increase the risk of additional attachment issues. So the type of attachment issues we're thinking about here is the placenta accreta. With the placenta accreta, the placenta is attached to the uterus abnormally. With this, we can see that it is on the uterine wall and it's penetrated enough that it's not going to easily detach. Further, you can have a placenta increta where the placenta starts to invade the uterine muscle. And with this, it's going to be even more difficult to detach the placenta from the uterus. And then with a placenta percreta, the placenta can grow all the way through the uterine wall and even attach onto other organs. So this is a potential possibility for a patient that has a placenta previa, but we can also see these abnormal attachments in other cases as well. So our goals and actions for a patient with either of these conditions, management is going to be dependent on the amount of bleeding that's happening, the gestational age of the baby, and how the baby's doing. So it's possible to have expectant management. This is especially true if we're less than 34 weeks and the baby and the mom are both stable. In this case, we'll give steroids so that we are prepared. We help the baby's lungs mature to be prepared in case of an early delivery. We're going to be monitoring frequently both mom and baby. We're watching the vital signs. We're watching the fetal heart tracing. We're watching for bleeding. And often there's activity restrictions, especially with the placenta previa. We want to limit activity, limit anything in the vagina, no intercourse. Oftentimes it's best bed rest, bathroom privileges type of thing. Active management is going to be aimed at controlling blood loss. And so if we are needing to work on delivery because we're having active significant bleeding, we want to have large bore IVs. We want to be prepared for delivery. If it's a placenta previa, we're definitely delivering via cesarean. If it's a placental abruption, it depends on the amount of bleeding and the condition of the mom and baby, whether or not we can try to have a vaginal delivery. Oftentimes those are cesarean births as well. And then we need to be prepared for the hemorrhage. So having blood products available, we should have, in addition to our large bore IV, we should have already done a type and screen, know exactly what blood products we need, have them on hand so that we are ready to transfuse if needed. And then we're monitoring for signs of hypovolemic shock or DIC. A pregnant woman can lose up to 40% of her blood volume before we see those changes in her vital signs. So monitoring her urine output, monitoring a lot of different things in relation to her body and her status is going to be important to determine if we're needing to give blood products. So when we review and recap, all right, placental abruption and placenta previa are going to be our two major causes of late pregnancy bleeding. The placental abruption is a detachment issue. The placenta is detaching from the uterine wall. Symptoms are going to vary depending on the significance and the degree of separation. If we have a small detachment, we might not see as many symptoms as if we have a large one. Risk factors include hypertension, trauma, cocaine, smoking, and our symptoms typically are going to be related to painful abdomen, rigid abdomen, painful uterus, dark red vaginal bleeding if we're bleeding, and abnormal fetal heart tracings. So this is another way of looking at this. So here it all is in one spot. It's a detachment issue. Our signs and symptoms are painful, dark red bleeding, rigid board-like abdomen, and fetal distress. Risk factors are the hypertension, trauma, cocaine, and smoking. Placenta previa is an attachment issue where the placenta is attached in the lower uterine segment. It'll partially or completely cover the cervix. Risk factors include a previous uterine scar or advanced maternal age. And this is painless bright red bleeding with a soft, non-tender abdomen. So altogether, this is an attachment issue attached over the cervix, painless bright red bleeding, soft, non-tender abdomen, normal fetal heart tracing. Risk factors include previous C-section, multiple pregnancies, and advanced maternal age. Our management priorities for either of these patients are going to be maternal well-being and fetal well-being, managing the bleeding, so our route of delivery, and then monitoring for and correcting hypovolemia. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.